I'm Maarten Snoeijs, vascular surgeon working in Maastricht, the Netherlands. I'm the course director of the Vascular Access course at the EVC. It's a pleasure to update you. We've actually just finished enrollment a couple of weeks ago, which means that we're now in the next phase of the study and waiting for one more year of follow-up of the final participants before we can start analyzing the data. And well, I hope then that we will have a good answer to the question what the best vascular access for elderly patients is who are starting hemodialysis treatment, because there's still controversy and clinical equipoise with regards to the best vascular access for these patients, be it an arteriovenous fistula, an arteriovenous graft, or a central venous catheter. And we're actually the study that's comparing the three different types of vascular access to each other. So this, I think, would be quite an important study that will, question that we will hopefully answer in the near future. So finished enrollment after some hard years of hard work, and now ready to get to the data analysis phase. Well, I think that registry data are very important, and I think that it is I would really advocate to have registries in each country that capture the quality of vascular access care. And I think the best way to do this is to simply register the number of interventions that are required for each vascular access, because it's probably the best best way to measure function, and also has a direct relation to patient satisfaction and healthcare costs. And it's not difficult to capture that information, and it allows us to compare units to each other to see which units are best examples, and which units can maybe change their strategies to reduce the intervention rates. So I think that is important from a quality control perspective. From a scientific perspective, it is difficult to capture all the relevant data in registry databases, because obviously this requires quite a bit of work to collect all the data, and this is not, at least in the Netherlands, it is quite difficult to find the manpower to collect and register all this data. We have a very nice program for the vascular access interested vascular surgeons. We have a lot of hands-on workshops, including thrombectomy, endovascular thrombectomy, open anastomosis creation, central venous catheter insertion, strategies for endovascular treatment of stenosis in the vascular access, central vein obstruction. We'll be covering all these aspects in hands-on workshops that are being offered by our commercial partners. And next to that, we have a very interesting scientific program with lectures from experts around Europe who have come all the way to Maastricht to give talks about vascular access creation, vascular access stenosis treatment, ischemia due to vascular access. And this year we also have a special session together with the dialysis nurses on vascular access cannulation, and a special session on basic science in vascular access. So these are two special features of this year's access program. A final new feature is that we offer a anastomotic creation championship, where you can where vascular surgery residents can actually make their best anastomosis and compete with other residents to win the Grand Prix prize that is being offered on the final day. Well, I think that the course is intended to teach young professionals and to train them with skills and information that they can easily apply in their own clinical practice. And the hands-on workshops are essential for that. So we have some workshops that are fully directed to the young vascular surgeons in training. There's a continuous workshop on how to create a perfect arteriovenous anastomosis. There's also workshops on central vein catheter insertion using ultrasound and using tunneled dialysis catheters. So these are for the surgeons that are starting their careers and starting their training. But there's also opportunities to learn how to use new techniques. For example, the wavelength endovascular fistula creation is being offered. There's the penumbra thrombectomy device that's being demonstrated, and it allows also the vascular surgeons who've been in practice for a couple of years to get to know new devices that may be very helpful in their own practice.